Okay, so let's deal with some questions for revision for the midterm 3 and lab test 3. First question is for lab test. Identify the marked structure in this posterior view of the larynx. This is the lower part of the pharynx containing the larynx, and then here superiorly, this is the back of the tongue, the posterior third of the tongue. The back of the hypopharynx or the laryngopharynx is open, so as the larynx is partially open, so we can see the larynx from behind. The larynx continues down as the trachea. So this is the trachea here. Of course, this is part of the esophagus behind the trachea, but this is the trachea. You can see some of the tracheal rings are located here. And this is the cricoid cartilage, the complete cartilage in the respiratory passages. This is the lamina of the cricoid cartilage. Look at this coronal section showing you the larynx. So again, this is the region of the cricoid cartilage. Here's the thyroid gland on either side. That's the thyroid gland. And you can see here we have these are the vocal folds and the vestibular folds. So the marked structure is not the vocal fold because we have seen the vocal folds here. This is the vocal fold and this is the vestibular fold. It's not the vestibular fold. The vestibular fold is this one, higher than the vocal fold. It's not the cricoid cartilage. Here's the cricoid cartilage. And it's not the thyroid cartilage. The thyroid cartilage is located more laterally here. So it is located in this region. That's the thyroid cartilage. In fact, it is the epiglottis. So this is the leaf-shaped structure, leaf-shaped cartilage, which is an elastic cartilage and acts as a valve at the laryngeal inlet. It is the epiglottis. Identify the structure. This is a dissection of the abdomen. Anterior abdominal wall has been removed. We can see that most of the viscera as well has been removed. This is the greater omentum is reflected upwards. You can see part of the liver here, and the small intestine, the large intestine, all of them have been removed. So we can see the posterior abdominal wall. This is the region of the midline. Just to the left of the midline is the aorta. So this is the aorta here. And just to the right of the midline is the inferior vena cava, the systemic vein. The renal arteries, these are the kidneys. This is a kidney and this is the renal artery. So the pointer is not at the renal artery. Arising from the aorta, we have this artery here, which is clearly shown on this side. This is a gonadal artery, which supplies either the testis or the ovary. Both of them are gonads. So this is the gonadal artery. It's not the marked structure. And it is not the inferior vena cava because we have just mentioned that this will be the inferior vena cava. Femoral artery is located here at this location. It is in front of the thigh in the femoral triangle. The femoral artery is the continuation of the external iliac artery, and so it's not the femoral artery. The aorta ends at this level by dividing into two main branches, and these are the common iliac arteries. So the correct answer is common iliac artery. It's called common iliac because it's going to divide into external iliac and internal iliac. The internal iliac supplies the pelvic viscera, and the external iliac continues as the femoral artery. Identify the structure. This is a dissection of the thorax showing the heart. You can see here the pericardium. This is the pericardium has been reflected away from the heart, and the external features of the heart have been dissected a little bit. Here's the apex of the heart, and this is the diaphragmatic surface of the heart where the heart lies on the diaphragm. And you can see the great vessels. One of the great vessels is this one, which is the ascending aorta, becoming the arch of the aorta at this location. And of the so this is the marker is not on the ascending aorta. This artery here is the ascending aorta. So it's not the ascending aorta. Superior vena cava, this will be the superior vena cava, goes to the right atrium. Here's the right atrium. And the superior vena cava is formed by the union of two brachiocephalic veins. So this will be the superior vena cava. It's not the marked structure. Coronary arteries, these are the coronary arteries, right coronary, and this is a branch of the left coronary. It's called the interventricular branch of the left coronary artery. And these are branches of the ascending aorta. So it is not a coronary artery here. The pulmonary vein, pulmonary veins, these veins are located behind. They drain into the left atrium. We have two veins on either side, and the left atrium is located at the back of the heart, and they bring oxygenated blood from the lung. Although they are veins, but they bring oxygenated blood, and they are called veins because they carry the blood toward the heart. They are part of the pulmonary circulation. So it's not the pulmonary vein. In fact, it is the pulmonary trunk. So it arises from the right ventricle. Here's the right ventricle. And this will be the pulmonary trunk dividing into right and left pulmonary arteries. And it carries deoxygenated blood. Although it's called, it divides into arteries, but it carries deoxygenated blood. The blood that comes from the right atrium to the right ventricle will be pumped here and will reach the lung to become oxygenated and return back via the pulmonary veins. So this one is the pulmonary trunk. It's the outflow tract of the right ventricle. Identify the structure. This is a mid-sagittal section of the pelvis. It's a female pelvis. You can see here, this will be the pubic symphysis in the midline, and this will be the sacrum and coccyx located posteriorly. So the marked structure is not the symphysis pubis. The symphysis pubis is located anterior to it. It is not the sacrum, and it is not the rectum, because here, this will be the anal canal, and then here's the ampulla of the rectum, and then becoming the sigmoid colon. So it is not the rectum. The vagina in the female is located anterior to the rectum. So here's the vagina, and that will be the section in the uterus. So it's not the vagina again, it is the urinary bladder. You can see here that this is the empty bladder is only confined to the pelvis, and this is the region where the it's called the bladder neck, which give rise to the urethra. It's not shown here, the urethra, but it is very closely related to the anterior wall of the vagina. Here's the opening of the vagina, opening of the urethra, and both of them, they open at the vestibule, the region of the vestibule. You can see here the labia majora, which is part of the vulva as well. So this is the urinary bladder. Identify the structure. This is a posterior view of the male internal genital organs. This is again the urinary bladder from behind. These tubes are the muscular tubes that represent the vas or the ductus deferens. You can see here that the vas is distended to form an ampulla of the vas, which joins the seminal vesicle, duct of the seminal vesicle, to form the ejaculatory duct. And the ejaculatory duct on either side passes through the prostate gland. So this is the prostate gland containing this part of the urethra, which is called the prostatic urethra. So it is the prostate. It is not the seminal vesicle. This is the seminal vesicle, which contributes to the formation of the semen. It is not the vas or ductus deferens. This will be the vas here, or the ductus deferens. And it is not the ejaculatory duct. The ejaculatory duct, in fact, is this duct which opens into the prostate. Okay? And again, it is not the bulbourethral glands. These bulbourethral glands, they are small glands. They secrete transparent fluid, And these are the small glands here, bulbourethral glands or Cooper's glands. They open, they are present in the urogenital diaphragm. You can see here the urogenital diaphragm, and their ducts open into the penile urethra. This is the penile or spongy urethra located in the corpus spongiosum. One more structure which is shown here we haven't mentioned about, which is this structure. This is the ureter. So ureter here, and then the other ureter on the other side. They open into the urinary bladder. Identify the structure. This is the liver, and you can see here that this is the visceral surface of the liver. The liver has a diaphragmatic surface, which is smooth, and it has a bumped visceral surface, which takes the imprints of the related viscera. The visceral surface is located more or less posteriorly or postero-inferiorly. You can see here that at the visceral surface there is some structures passing in and out of the liver. One of these structures is this vessel here, and this is the portal vein, so it is not the marked structure. Also passing through the liver and even embedded in part into the liver is the inferior vena cava, which opens into the heart above the diaphragm, okay, into the right atrium of the heart. So this will be the inferior vena cava. It's not the marked structure. The lobes which are mentioned here, we have the right lobe, we have the left lobe of the liver, and as subdivision of the right lobe of the liver, we have this lobe, which is called the caudate lobe, because it has a small tail that connects it with the remaining part of the right lobe. And then we have this lobe here, which is quadriangular in shape and called the quadrate lobe. So this one is the caudate, so it's not the caudate, and this one is the quadrate, and so it's not the quadrate. In fact, this structure here is the gallbladder. So this is the gallbladder. Here's the fundus of the gallbladder, and you can see here it give rise to a cystic duct. That the cystic duct will join the common hepatic duct to form the common bile duct. So this is the gallbladder. It is where bile is concentrated and stored. Identify the structure. This is a longitudinal section in the kidney, and you can see here that the outer part of the kidney, where the glomeruli are located, where the proximal and the distal convoluted tubules are located, this is the renal cortex. And then you have the renal medulla. The renal medulla contains the loops of Henle and the collecting ducts. You can see that it is pyramidal in shape. The base of the pyramid borders the cortex, and the apex of the pyramid is called the renal papilla. And the renal papilla is projected into the drainage system of the kidney, which is indicated by the yellow structures. The drainage system continues down as the ureter. So this is the ureter here, the narrow part. And the ureter is distended here as the pelvis of the kidney, the renal pelvis. So it is not the marked structure, the renal pelvis. And the renal pelvis is, in fact, it is formed of small and large glasses, calyces. So we have this small glass here, another small glass there, which is the marked one, and then another small glass. These are minor calyces, and they unite to form a major calyx. And here's another major calyx coming from here to form the renal pelvis. Okay, so 3 to 4 minor calyces unite to form 2 to 3 major calyces, and then these unite to form the renal pelvis, and the renal pelvis passes through the hilum of the kidney, goes downwards, become narrowed to form the ureter. And so the correct answer is the minor calyx. And the part of the medulla that projects into it is called the renal papilla. Identify the structure. This is another mid-sagittal section of a female pelvis. Here is the anterior aspect. You can see the pubic symphysis, and posteriorly, this is the site of the sacrum, not very clear. You can see here the anal canal, the ampulla of the rectum. Here, this is the rectum located posteriorly. So this is the posterior aspect. The vulva is this region, is the region of the uh, external genitalia of the female, and into the vulva there's the vestibule, which receives the opening of the urethra. You can see the urethra here continues from the urinary bladder. This is the urinary bladder. Look at the thick muscular wall of the urinary bladder. And then in the vestibule is not only the opening of the urethra, but the opening of the vagina. Here's the opening. This is the vagina, and the vagina is continuous upwards as the uterus. So the marked structure is not the vulva. The vulva is the female external genital organs. It's not the vagina. It is not the uterus. Connected to the uterus here, this is the uterine tube. You can see the uterine tube, and the uterine tube has the lateral end of the uterine tube is a little bit distended here, forming the infundibulum. And the infundibulum is very closely related to this almond-shaped structure, which is located posterior to the broad ligament, and this is the ovary. So the correct answer here is the ovary. Identify the covering indicated by the pointer. This is a dissection of the thorax, and you can see the two lungs, the right lung and the left lung. Each of these lungs are actually, they are covered by a very thin membrane, which is called the pleura. And in fact, this pleura is a serous membrane, which has a visceral layer and a parietal layer. And the part which is closely related to the lung is the visceral pleura. So it is the visceral pleura is not the marked structure. Also, it is not the parietal pleura, because the parietal pleura, it lines the thoracic cavity, it covers the diaphragm, and it continues to line or cover the mediastinal structures. So again, it is not the pleura, it is not the parietal pleura. This layer or this membrane that is shown here, it covers the heart. So it's pericardium. And the pericardium is in two parts. It is either the fibrous pericardium, or it is the serous pericardium. And the serous pericardium is in two layers, like the pleura. Either it is the visceral pericardium, which is directly applied to the heart. It is even part of the heart, the outermost layer of the heart, also called the epicardium, and it is not this layer. And then we have the parietal pericardium. In fact, the parietal pericardium lines this fibrous pericardium. The fibrous pericardium is a little bit rough and located outside, and you can see that it fuses even with the roots of the great vessels here. So this is the fibrous pericardium. If this fibrous pericardium is cut open and reflected to the side, then within it, on its the other side of the layer, will be the parietal pericardium, and immediately in front of the heart or surrounding the heart, attached to the heart, will be the visceral pericardium. And the pericardial cavity is located between the parietal pericardium and the visceral pericardium, because the parietal pericardium is fused with the fibrous pericardium. It is like head and tail. They are fused together. They cannot be separated, so there is no space in between them. The correct answer here is the fibrous pericardium. Which of the following are classified as agranular leukocytes? Leukocytes are of two types. They are either granular or agranular, depending on the abundance of the granules in the cytoplasm and on the staining properties of these granules. So the granular leukocytes, their granules either stain with acidic dyes, and they are called eosinophils, or with basic dyes, and they are called basophils, or their granules are neutral, So they are called neutrophils. So all of these, the eosinophil, basophil, and neutrophil, they are granular leukocytes. Reticulocytes, these are the newly formed red blood cells as they develop in the bone marrow and they reach the blood circulation. They lose their nucleus. At the beginning, they are called reticulocytes, and then they will form the red blood cells as they lose their nucleus. So actually, they are not related to leukocytes. The reticulocyte is one of the stages of the formation of erythrocyte, of red blood cell. Megakaryocytes, these are the large cells which are present in the bone marrow, and they are the precursors of the platelets. So megakaryocytes, they are formed of fused multiple cells together. That's why they have multiple nuclei. Very large cells, mega, fragments of their cytoplasm will be released to the circulation as platelets. So they are not related to the white blood cells. They are not leukocytes. The agranular leukocytes here, the choice that we have are the lymphocytes. We have two types of them. We have either lymphocytes or monocytes. So the correct answer here is lymphocytes. The vena cava and coronary sinus return deoxygenated blood to which chamber of the heart? Let's study this view of the heart from behind. And you can see here that this is the left atrium. And the left atrium, left side of the heart, contains oxygenated blood. And the left atrium, in fact, it receives the 4 pulmonary veins. They are called veins, but they carry oxygenated blood because they carry blood toward the heart. And this, therefore, the left atrium contains oxygenated blood. So it is not one of the choices here. The left atrium will pump the contents from the left atrium to the left ventricle through the left atrioventricular opening, which is guarded by the mitral valve. So the left ventricle contains oxygenated blood. The deoxygenated blood is received into the right atrium. So this is the right atrium from behind. And you can see here that it receives the superior vena cava, the inferior vena cava, as well as the coronary sinus. This big venous sinus that carries blood from the muscle of the heart, the blood that is supplied by the coronary circulation, it will be drained by the coronary sinus into the right atrium. So all uh, venous blood, deoxygenated blood from the body will be collected in the right atrium. And so the superior and inferior vena cava here and the coronary sinus, they return the blood to the right atrium. And then from the right atrium, the blood will be pumped to the right ventricle through the right atrioventricular opening, which is guarded by the tricuspid valve. Both atria, this is wrong because the left atrium receives oxygenated blood from pulmonary veins. Capillaries found in the kidneys and most endocrine glands are most likely to be, mainly there are 3 types of capillaries. We have the continuous capillaries, like this one. The continuous capillaries with no intercellular clefts are located when barrier systems are required. For example, in the blood-brain barrier, which controls the passage of substances between the circulation and the brain. So these capillaries are continuous capillaries with no intercellular clefts. These capillaries with no intercellular clefts means that there are tight junctions in between the cells. The continuous capillaries with intercellular clefts are present in, for example, in the lung for the exchange of gases between blood and alveolar spaces. So these are continuous capillaries. Whenever there's fenestrated capillaries like this one, this is a fenestrated capillary, there are pores within the endothelial lining of the capillaries, which means that there is more exchange is required here. And these fenestrated capillaries, for example, in endocrine glands where hormones are secreted into the blood, so the capillaries there are fenestrated. Also, in case of the kidney, where the capillaries have very big fenestrations for the filtration, the glomerular capillaries, in fact, for the filtration of the blood to the nephron. So these capillaries are the kind of capillaries, the fenestrated capillaries are the kind of capillaries that you find them in the kidney and endocrine glands, where a lot of exchange is taking place here. Large molecules can pass. The sinusoidal capillaries are also having big fenestrations within the endothelial cells, but in addition to that, the basement membrane, this blue structure here, is discontinuous. It's not continuous like in the fenestrated capillaries here. This one is also fenestrated in the sinusoids. And a typical example of sinusoids are the sinusoids that are present in the liver between the hepatocytes, or the sinusoids of the spleen, or the sinusoids of the bone marrow. These are the typical places where sinusoidal capillaries are located. The mechanisms listed below which contribute to lymph return to the blood are respiratory pump, inhalation, heart contraction, muscle pump, contraction of skeletal muscle, lymphatic valves, and peristalsis. So as we know that most of the lymph of the body is drained from the lower extremities and the abdomen and goes up to drain into the venous system, as you can see here. Usually it drains on the left side, most of it, 3/4 of it drains on the left side at the junction of the left subclavian and the left internal jugular vein. But some of it is drained to the right side, 1/4 by the right lymph duct. On the left side, it is called the thoracic duct. And like in the veins, the lymphatic vessels, they have a lot of valves. And as you can see here, these valves, they allow unidirectional flow of lymph. And so the valves are very important here in the return of the lymph, like in the veins. Another mechanism that will contribute to that is the muscle pump. Muscles which are, for example, the muscles which are located in the lower extremity, let's say these are muscles like the for example, gastrocnemius and soleus muscle, which are located in the calf. So if you have a muscle here, you have muscle fibers there. So when these muscles contract, they are going to squeeze the thin walls of the veins as well as the thin walls of the lymphatic vessels. And as these lymphatic vessels are squeezed, then the content of the lymph will be forced to go in one direction because of the presence of the valves. So 3 is important as well. Peristalsis does not play that squeezing effect on the lymphatics. The other factor that contributes is the respiratory pump, inhalation. Whenever there is decrease in the intrathoracic pressure during inspiration, the diaphragm descends down, and so there is decrease in intrathoracic pressure, and this will suck the lymphatic fluid up because of the negative pressure. At the same time, decreasing the pressure inside the thoracic cavity produces a positive pressure inside the abdominal cavity, which will push again, it will push and squeeze the lymphatics and push the lymphatic fluid to one direction toward the heart. So the respiratory pump is important here. Contraction of the heart will not play an important role because the heart does not have any effect on the lymph that is present in the lymphatic vessels. The lymphatics are drained into the venous circulation, and the pumping action of the heart plays no effect in this respect. So this leaves us with options 1, 3, and 4 to be the factors that are responsible for or contribute to lymph return to the blood. The right lung has how many lobes? Each of the lungs is conical in shape. Each lung has an apex, it has a base. So this is the apex of the lung, here is the base of the lung. And on the left side, the part of the lung is taken away because of the presence of the heart on the left side. Most of 2/3 of the heart is deviated to the left side. The lung is divided into lobes. Both lungs, they are divided by an oblique fissure dividing the lung into an upper and lower lobe. In addition to that, the right lung has another lobe here, which is called the middle lobe. So this leaves us with right lung having three lobes, while the left lung having two lobes, because actually the middle lobe on the left side here, this middle lobe, is taken away by the presence of the cardiac notch and is replaced or represented by a small tongue-like process that belongs to the upper lobe, and this is called the lingula. You can see them here. That is the lingula, and these are the three lobes of the right lung. So the correct answer here is that there are three lobes in the right lung. The trachea is lined with the trachea is lined with respiratory epithelium, and this respiratory epithelium is not a simple squamous epithelium. Simple squamous epithelium, you find it, for example, in the lining of the blood vessels, the lining of the alveoli, lining of blood vessels, it's called endothelium, for example. And in the respiratory passages, you will find it in the lining of the alveoli, where exchange of gases should take place. The trachea is not part of the respiratory portion of the respiratory tube. It is part of the conducting portion of the respiratory tube. So it needs to be lined with an epithelium that provides warmth, traps particulate matter and foreign substances, and moves the mucus away toward the pharynx. And that's why it is lined by a ciliated epithelium. These cilia, they have this sweeping action. So it is a pseudostratified columnar ciliated epithelium. Pseudostratified because although all the cells they lie on the same basement membrane, but the cells are of different heights, and because the cells are of different heights, then their nuclei will appear at different levels, and so this will give us an impression that the epithelium is stratified, whereas it's not stratified. It's a single layer of cells, but the cells are of different heights. Not all the cells they reach the lumen, and we can see that the cells reaching the lumen, they have these cilia which always beat. In addition to that, it is having mucus glands in the form of goblet cells, unicellular mucus glands. So they produce a thin film of mucus here on the surface that traps the particulate matter, and this is going to be washed away or swept away by the beating of the cilia. So it is pseudostratified columnar ciliated epithelium. It is not simple columnar epithelium with microvilli. Microvilli are usually required for absorption, and the simple columnar epithelium with microvilli is, for example, present in the small intestine and serves mainly for absorption. A simple cuboidal epithelium is a typical epithelium that you expect to find, for example, in the tubules of the kidney or in the thyroid gland. And a stratified squamous epithelium, which is non-keratinized, is present in the pharynx, for example, in the oropharynx and in the laryngopharynx. It's a kind of protective epithelium. It's also present in the mouth, in the vagina, in the anal canal, lower part of the anal canal. So it's more or less, it's a kind of protective. But the trachea is lined with respiratory epithelium, which is pseudostratified columnar ciliated epithelium with goblet cells. Which structure is located within the curve of the C-shaped duodenum? So the duodenum has a C shape. It is the first part of the small intestine. It's about 25 centimeter in length. And as you can see it here, this is the C shape of the duodenum. The duodenum continues as the jejunum. And within the C shape is the pancreas, the part of the pancreas which is called the head of the pancreas. The remaining parts of the pancreas, we have the body and the tail of the pancreas. Here is part of the pancreas which is called the neck, and here is another part which is called the uncinate process. But actually, it is the head of the pancreas that is located within the curve of the C-shaped duodenum, the head of the pancreas. The tail of the pancreas is more or less related to the spleen here on the left side, on the left hypochondrium. The cecum is not related here. The cecum is present far away in the right inguinal region. The spleen, as I mentioned, is related to the tail of the pancreas. And the gallbladder, in fact, it is related to the first part of the duodenum, but does not lie within the C shape of the duodenum. It is the gallbladder is related to the visceral surface of the liver. What is the function of the muscularis layer in the body of the stomach? In the wall of the stomach, like in the rest of the digestive tract, there are multiple layers. So we have a mucosa, we have the submucosa, we have the muscularis, and an outer adventitial layer. In the stomach there is a lot of digestion, and two types of digestion take place here: the chemical digestion as well as mechanical digestion. There is a lot of churning taking place here, churning and mixing, and this is the action that is provided by the muscularis layer. And that's why the muscularis layer here in the stomach is not formed of two layers like in the most of the rest of the gastrointestinal tract. We have inner circular and outer longitudinal. Here we have an innermost oblique layer here to allow for more churning and mixing of the contents of the stomach, more mechanical digestion. The muscularis does not secrete the gastric juice because the gastric juice is secreted by the mucosa. It does not is not responsible for absorption. The small amount of absorption of water, alcohol, and some drugs like aspirin that take place here in the stomach is not the function of the muscularis, it's the function of the mucosa itself. Regulates the slow delivery of chyme to the duodenum. This regulation is taken over by thickening of circular muscle fibers, which are located in the pylorus of the stomach. But this is what we call the pyloric sphincter. So it is not in the body of the stomach. The stomach has this region which is called the cardia, and then we have the dome-shaped area here which is called the fundus, and then the narrow part which is called the pylorus, and the remaining part of the stomach is the body of the stomach. We are talking about the muscularis and the body of the stomach, not in the pylorus. In the pylorus and pyloric sphincter, yes, the muscularis layer, the thickening of the circular muscle fibers will regulate the delivery of chyme to the duodenum, but this is not the function of the muscularis layer of the body of the stomach. Formation of the rugae. Rugae, these are folds of the mucosa and submucosa, and they are not fold of muscle fibers, not folds of the muscular layer. They are fold of the mucosa and submucosa. They are longitudinal folds as opposed to the circular folds, the plici circularis, that are present in the duodenum. But in both cases, the folds are folds of mucosa and submucosa, not folds of the muscular layer. The vestibule of the mouth is the area located. The vestibule of the mouth, and you can see here, if you open the mouth and look at your mouth in front of the mirror, you will find that at the back of your mouth, there is the oropharynx here. At the far end is the oropharynx, and between the oropharynx and the mouth cavity proper, there is an arch here, which is connected to the soft palate. Here's the region of the soft palate with the uvula, and the arch here is called the palatoglossal arch. As its name indicates, it is also connected to the tongue, so it's glossal. And then behind it, you can see here that there is another arch, which again from the palate to the pharynx, and it's called the palatopharyngeal arch. And in between them, there is the tonsillar fossa, which contains the palatine tonsil, or the tonsil, which is collection of lymphoid tissue here. So the mouth, in fact, or the vestibule of the mouth, is not located to palatopharyngeal arch, because behind palatopharyngeal arch, or between the palatopharyngeal and the palatoglossal arches, are located the tonsil, and this is part of the oropharynx. It's not the mouth. If it is anterior to the palatoglossal arch, yes, this is part of the mouth. This is the mouth cavity proper, is anterior to the palatoglossal arch, but we are dealing here, we are asking about the vestibule. So the vestibule is not, this is not correct. The vestibule is the part of the mouth cavity which is located outside the teeth. So either between the teeth and the cheeks, or the teeth and the lips, this is what we call the vestibule of the mouth. It is not between the tongue and the floor of the mouth. Between the tongue and the floor, it is the mouth cavity proper. It is inside the teeth. So everything inside the teeth is the mouth cavity proper, but outside the teeth, it is the vestibule of the mouth. So the correct answer here is that the vestibule of the mouth is the area located between the cheeks and the teeth. Which part of the nephron may extend into the medulla? You can see here a section in the part of the kidney showing the cortex here to the outside and the medulla. This is the medullary pyramid here, and this is the magnified part. You can see the papilla at this point. Here's the papilla, and many of these papillary ducts are opening at the tip of the pyramid. You can see a drop of urine here dropping down to go into the pelvis of the kidney. Actually, to go to the minor calyx, the major calyx, and then to the pelvis of the kidney. So the nephron is formed of the Bowman's capsule here, which is located in the cortex, and then it gives rise to the proximal convoluted tubule. Then we have the loop of Henle, which goes into the medulla, and descending limb, then ascending limb, then the distal convoluted tubule. So the Bowman's capsule is present in the cortex, the proximal convoluted tubule is present in the cortex, the distal convoluted tubule is also present in the cortex, and whenever there's a juxtaglomerular apparatus, the juxtaglomerular apparatus is where the afferent arteriole of the glomerulus comes very close to the ascending limb or the distal convoluted tubule to form the juxtaglomerular apparatus, and both these are present in the cortex. So the juxtaglomerular apparatus is also present in the cortex. It's only the loop of Henle with its descending and ascending limbs that are mainly present in the medulla, which is formed by the medullary pyramids. Pathway of sperm flow through the ducts. We have the ejaculatory duct, ductus deferens, seminiferous tubule, epididymis, and the urethra, and we have to arrange these in sequence so that they represent the pathway of the sperm flow. The sperms are formed inside the testis, and you can see here this is a longitudinal section in the testis showing you the tunica albuginea with multiple fibrous septa dividing the testis into lobules. Each lobule contains seminiferous tubules where the sperms are going to be produced. So the first place here will be the seminiferous tubule. From the seminiferous tubule, the sperms are taken to a network of tubules that then efferent tubules that will take the sperm to a very highly convoluted tubule here, which forms the epididymis. So the second place to go is the epididymis, and then the epididymis, as we go distally from the head, body, and tail, the epididymis, the tube inside the epididymis becomes thicker and the lumen becomes bigger, and it forms the ductus deferens, which goes into the spermatic cord. So the third place to go is the ductus deferens or the vas deferens. Here also you can see the vas or ductus deferens, which has a very thick muscular wall. In this posterior view of the bladder and the prostate, you can see the ductus deferens coming from the anterior abdominal wall backwards to the back of the urinary bladder. Here it's distended to form the ampulla of the vas and then narrows down to form the ejaculatory duct. So the fourth place to go is the ejaculatory duct, and into the ejaculatory duct, fluid from the seminal vesicles will be poured during ejaculation, and all the content will pass to the part of the urethra in the prostate, which is called the prostatic urethra, and from there it goes to the membranous and then to the penile urethra. So the fifth place to go is the urethra. So the first place in this case will be number 3, and then 4, and then 2, 1, and 5. And that will be the correct combination here. Which of the following layers of the uterus shed during menstruation? Here you can see a section through the uterine wall. It shows you the endometrium and the myometrium. Of course, there is another layer which is called the perimetrium. The myometrium, as the name indicates, is formed of muscle fibers. It's very thick, smooth muscle fibers, very thick layer, and it increases in size. The muscle fibers increase in size and increase in number during pregnancy. They do not shed during menstruation. You can see here in the section on the left, this is at the second week of the menstrual cycle, and you can compare the thickness of the endometrium here to the thickness of the endometrium on the right side, which is in the third week of the menstrual cycle. This is the secretory phase of the menstrual cycle, and this one is the proliferative phase. The myometrium does not shed. The perimetrium is formed of connective tissue and covered with peritoneum. It doesn't shed. It is the endometrium that sheds, and it's not the entire endometrium that sheds, because there's part of the endometrium here which is called the stratum basalis, which is very close to the myometrium. This does not shed during menstruation. It remains, and then it proliferates and forms the new thicker endometrium, and then proliferates to replace the shed endometrium. So the endometrium is in fact in two layers. It is the stratum basalis and the stratum functionalis. And it is the stratum functionalis here, which during the secretory phase, it contains multiple glands. It is this part of the endometrium, the functionalis, is the part that sheds during menstruation. Basalis does not shed. If the endometrium was the only choice that we have here, then we will choose the endometrium. But since we have more details, then the endometrium as a whole, it does not shed. It's only the stratum functionalis that sheds. So this will be the incorrect choice in this combination. The moriola is the direct result of fertilization, is a solid cell mass. It contains a cavity, is the stage that implants into the endometrium, contains trophoblast and embryoblast cells. So during fertilization, the haploid sperm nucleus and the haploid secondary oocyte nucleus, they merge together to form a single diploid nucleus, which is called the zygote. So the direct result of fertilization is the zygote. It is not the moriola. What happens after the zygote is formed is that there will be cleavage of the zygote into two cell stage, as you can see here, and then another cleavage to four cell stage, and then the moriola is formed at day 4. And as you can see here, that it is formed from rapid mitotic cell division of the embryo during cleavage, and it is a solid ball of cells. Moriola means mulberry, so it's a solid ball of cells. Solid ball of cells, this would be a correct choice here. It doesn't contain a cavity, because once it contains a cavity, as you can see here, from day 5 and then the days afterwards, this is called the blastocyst cavity, and it's no more called the moriola, it is called the blastocyst. So the moriola is solid, it doesn't contain a cavity. Once it contains a cavity, it is called the blastocyst, and it is the blastocyst that is the stage of implantation into the uterus. So it's not the moriola that is the stage that implants into the endometrium, but it is the blastocyst. Contains trophoblast and embryoblast cells. In fact, these are the features of the blastocyst. The cells will be segregated into embryoblast and the trophoblast. The trophoblast will develop into the fetal portion of the placenta and secrete the human chorionic gonadotropin, and the embryoblast will become the embryo. So the trophoblast and embryoblast are features again of the blastocyst. The question is about the moriola. The moriola is formed of a solid ball of cells, and it results from rapid mitotic cell division of the embryo, and it does not have any cavity.